Hi, I'm here with my patient, Mr. Shark, and he has ostomy, and we have an order from his physician to check out the ostomy and change the bag. So first, I'm verifying the physician order, and I have all my supplies ready to go. Now I'm going to identify the patient, so I know that the patient is giving me their first name, their last name, and their date of birth. Now I'm going to perform hand hygiene and put on some clean gloves. So now I'm ready to actually change the ostomy. So I'm going to we use adhesive remover typically to remove the seal. And we take off the ostomy bag and we empty it in the biohazard and clean it out and everything and dispose of it if we need to. There are disposable bags and there are reusable bags. So this is a disposable bag, so I'm just going to put it in the biohazard container. And I'm checking out the stoma now. I'm wanting to make sure it's pink, it's moist, and it's got a good color to it because we want to make sure it's got a good vascularity to it. Now after, I'm also cleaning up the site, so just patting it down, making sure if I have any of the stool or anything on there, I'm cleaning it all up because that will interfere with me putting on a new bag. Alright, so after that's all cleaned up, I'm actually going to remove these dirty gloves and put on a clean pair. So I'm taking these off and I've got a clean pair of gloves on. So now I'm going to measure my stoma. So typically you measure your stoma, and patients typically know, like if they've had it for a prolonged period of time, what size there are. So you would just measure the stoma and you would take a marker and you would draw a circle around it to make sure you have the proper edging or anything. You don't have to do the marker, you can just like eyeball it and say, okay, it's around the 30 mark in the measurements. But I like to mark it just because I want to make sure I get the perfect fit. And then you just cut it out with some scissors. And after that, you remove the adhesive sealing on the back. And you remove that off and you slide it over the stoma. And you're making sure it's nice and sealed. Now when we cleaned the area, we made sure that everything was clean and dry so this wouldn't interfere. If we would have left any of the fecal matter or anything, or even any of the cleaning solution or water in the area, it would have interfered with this adhesive, like adhering properly, and we don't want that because then they'll have leaks everywhere. So we're securing it. All right, and always before you apply your bag, you want to make sure it's closed because the fecal matter can come out at any time and we really don't want mess everywhere. So we're making sure our bag's nice and closed. And then I remove my gloves, perform hand hygiene, and I document the procedure. So I just go over what I did, what I found, and I measure how much of the fecal matter that was in the ostomy. So before I dumped it out into the biohazard container, I measured it in a colander and I got 30 mils. So I'm documenting it's 30 mils. I document what the consistency was, what the color was. I'm just keeping track of everything. So especially for I's and O's and physician purposes to make sure we are functioning properly with this new ostomy. And then I'm going to see how the patient reacted to it, and I'm going to come back and check on my patient about 20 to 30 minutes after just to make sure like the seal is good, they're comfortable, and that there's no leaks or anything. And that's it.